Hello, I am Dr. Kusum Sahni. I am Senior Consultant Gynecologist at Fortis Femme, Shalimar Bagh. I have been practicing in this field for nearly 30 years now, and different types of patients come to us. Today I am going to discuss about few gynae issues in younger women.
Do you think menstruation is still considered a taboo in India?
In rural areas maybe yes, because it is not discussed as a common household thing. But in educated class in urban India, people are very open to discussion about menstruation. I have even seen girls coming with their fathers for their menstrual problems. So in a way it is coming up as an open issue in urban India, and I'm sure rural India will soon follow it.
What is the role of a woman in educating her children about the topic?
In general, it's a woman issue and women only can discuss with younger women. So at home, generally it is the mother, a nani, dadi, an elder sister, or maybe someone else in the family who can take this issue with younger girls who are going to approach menarche age. And in school, generally such sessions are taken by female teachers.
Irregular and heavy periods is a common condition. When should it be a reason for concern that elicits a doctor's consultation?
First and foremost is that as women, all of us should follow a menstrual calendar. Only when we know what is our normal menstrual cycle, we can actually decide whether our periods are regular or irregular or whatever. And the same habit has to be inculcated into the younger girls, so that after about 15 or 16 years of age, she should be able to maintain her own menstrual calendar. It's only when you know what is your normal cycle that you can make a judgment that your period is coming at irregular intervals. In brief, if a woman is getting her menses earlier than 22 days, or the flow is too heavy, or lasting more than 7 days, or there is some bleeding in between two periods, this is the time you need to consult a doctor.
What are common gynecological conditions new moms are susceptible to? How can you treat the condition?
A new mom is a woman first of all. So she is prone to all kinds of problems which any woman can have. And the commonest ones are vaginal infection, irritation at the vulval skin, unplanned pregnancy, irregular menses, unprotected sex, and a urinary tract infection.
Urinary tract infection is quite common in women. What remedial measures can women undertake to treat the ailment?
First of all, it's something wrong to make a diagnosis of urinary infection on your own. So many times women have some infection in the vagina and they think it is urinary infection, and they go to a chemist and start taking self-therapy. That has to be avoided. Anytime you feel that you have urinary infection, you must start drinking plenty of water, other liquids, and maybe fresh lime 2-3 times in a day. If your symptoms subside, maybe it was just because of drinking less water and it is not actually a urinary infection. It's only if after drinking plenty of water, the symptoms are still persistent, you need to leave your urine sample for routine and culture testing. And only if the culture shows infection, it is taken as urinary tract infection, and you need to take antibiotics according to susceptibility of antibiotics.
Could you elaborate on the importance of postnatal follow-ups?
Postnatal follow-up is as important as antenatal checkups. Most of the times after a delivery is normally conducted, the mother gets so busy with the baby and no one else in the family will ever think that she needs to go for a checkup. But postnatal checkup is equally important because we need to see few things and advise few things to the patient. First of all, we'll have to see is there any infection in the vagina, in the stitch line, if it is a normal delivery, or any infection in the cesarean scar stitch line. Second, which is the most important thing, is that we have to discuss about contraception, because at this time patient is completely engrossed with her baby, and an unprotected sex can lead to unwanted pregnancy, which becomes a problem later on. So we have to counsel the woman regarding use of contraception. We discuss the options with the patient and let her make a choice. And an internal checkup is important to see that the uterus has come back to its normal size and shape, so that in case such a thing has not happened, we need to look for a cause.
What is the importance of preconception counseling in India?
Preconception counseling is important everywhere in the world, more so in India because we don't have a healthcare system which screens all girls for congenital genetic disorders. In India, it is more important because we don't have a healthcare system which screens young girls for any kind of genetic disorders. The history is also not clear in so many cases. Some diseases if the girl has and the parents don't tell the in-laws, thinking that this will get cured after marriage. All these things are in dark. So a preconception counseling is very, very important in India. We have to see, is there any congenital defect, any genetic disorder, is her hemoglobin right, because anemia is very common in India. We have to screen her for thalassemia. We have to see her immunization status. We have to add vitamins in her supplements because she has to take enough folic acid when she conceives so as to decrease the risk of birth defects in the baby.
What points should be addressed while counseling a woman before conception?
We have to see that her hemoglobin is right, her basic investigations are done, a thalassemia screen is done, and it is ensured that she has received her rubella and chickenpox vaccination, because these are two such infections which if she gets during pregnancy are not good for the baby. And of course, we have to start a supplementation of folic acid and vitamin B12. Most of the Indians being vegetarian and even the non-vegetarians eating meat very infrequently, B12 deficiency is very common in India. So B12 and folic acid combination has to be started at least 2 months before she conceives. If it is a high-risk pregnancy, if the girl is already suffering from some disease or was on some medication, we have to ensure that the disease is controlled and she is on the safest, lowest dose of medication, preferably single medication for single disease.
What measures can best prepare a woman's body for pregnancy?
A healthy diet, a good physical activity schedule which patient is able to follow should be the thing before she conceives. She has to be started on supplements, and if there is enough time and she hasn't taken her vaccinations earlier, she should preferably be vaccinated against rubella, varicella and hepatitis B. Because all these things, if they happen during pregnancy, they are not something good to have. And most important of all is that the woman has to have a positive attitude towards pregnancy so that she sends good vibrations to the baby who's going to come and is in a welcoming mood. So it should be a planned pregnancy with a positive attitude. So in total, I would say, since the world is on for women empowerment and knowledge only will bring empowerment. So we have to educate our young girls regarding menstruation, menstrual hygiene, regarding good and bad touch in childhood only. And when they are ready to get married, they should visit a doctor for a premarital counseling. Before planning a pregnancy, they should visit a doctor for preconception counseling, start taking their supplements, get their vaccination completed. Once they become pregnant, they should visit the doctor regularly for antenatal checkups. For antenatal checkups, even if you don't have a complaint, you need to visit the doctor once a month for the first 7 months. And all the tests which your doctor prescribes you to go for, you must always get those done. They are for your benefit. In pregnancy, we give 2-3 vaccinations which are important. The first dose is given as injection tetanus toxoid, and the second dose of tetanus is now replaced by injection Boostrix or Tdap, because that will protect your baby from pertussis and diphtheria in the first 1.5 months of pregnancy. And since flu is becoming very common these days, a flu vaccination in pregnancy is also very important. You must ask your doctor to give you flu vaccination in pregnancy. So once your childbearing is complete, your family is complete, you have rest of life to enjoy for yourself. But it's better that you start using some good contraception so that you don't get caught up in an unplanned pregnancy.